Good afternoon. Good afternoon. Welcome to this very important event. My name is João Breda, and I'm the head of the Quality of Care Office based here in Athens, the Athens Quality of Care Office, and also advisor for the regional director for the establishment of sub-regional offices. And it's really a pleasure to moderate today this part of the meeting. First of all, I would like to welcome the honorable ministers that accepted to join us here today in launching this important publication. With no further ado, I would like to ask our regional director, Dr. Hans Klug, to take the floor and address the audience of this event. Dr. Klug, the floor is yours. Thank you.
Good afternoon, everyone. Honorable Alternate and Deputy Minister of Health, distinguished colleagues and friends. It's a great honor to be launching our pocketbook in the presence of the Alternate and Deputy Minister of Health of Greece and health ministers from 3 countries, including Armenia and Romania. I must extend particular thanks to the Honourable Minister Pleuris of Greece and his ministry for hosting us here in Athens today. But it is indeed an auspicious start for our pocketbook to have 3 ministers present to witness its birth. To me, this indicates a high level of political commitment to this initiative. A second auspicious sign for the pocketbook is that we are launching it today at the Ministry of Health on Aristotle Street. Aristotle, the giant of ancient Greece, is regarded by many as the world's first genuine scientist. And he gave the world one of my favorite quotes: "Health is a matter of choice, not a mystery of chance." At the population level, policy choices by Minister of Health, such as how we organize our health systems, can drive positive health outcomes. Our launch today of the WHO Pocketbook of Primary Healthcare for Children and Adolescents is an example of this kind of choice. We are reconfirming our choice to provide quality primary healthcare to our children. We will not leave their health to chance. Primary care is the most inclusive, effective and efficient approach to enhance both physical and mental health and well-being. This holds true for all population groups, including children and adolescents. This is why in the declarations of Alma-Ata and Astana, governments and the global health community have chosen primary care to deliver health for all, no matter where you come from. So if we want to further improve the health and well-being of our children and adolescents, we need to look at how they experience primary care. For example, does the care available meet their needs? Is it easily accessible where and when they need it? Unfortunately, the reality is that the primary care service available to children and adolescents in our countries are not always optimal. And there are several reasons for this, but key among them is lack of up-to-date knowledge of good practice among healthcare providers. All too often, providers lack the knowledge and resources to provide care which is both evidence-based and in the best interests of the child or adolescents. The Prime Minister of Greece, Mr. Mitsotakis, who was with us at the opening of the Quality of Care Office of WHO Europe and the launch of the Pan-European Programme on Quality of Care of Health of Children this morning, told, "We in Greece follow evidence-based medicines." An example for the rest of the region. Colleagues, the gap that I just was mentioning will be filled by the pocketbook of primary health care for children and adolescents. It does this by providing up-to-date guidance and setting standards for evidence-based primary health care services, It is practical, applicable, and thus fully aligned with the European Programme of Work United Action for Better Health. Actually, when I, in a previous life, was pediatrician, I had the predecessor of this book always in my white shirt. I know how useful it is. Thank you so much, Greece, Evcharisto Poli, for giving us the opportunity to have this very timely update. Our aim is that these services should be available to youngsters across all 50 countries of the WHO European region. Why, thanks to the support from Greece, we can translate it and adapt to the country-specific realities and circumstances. This is the most noble mission we have. And then applying the guidance and standards in the book will require, of course, leadership and resources. Leadership which I have witnessed this morning when we had Prime Minister and 5 ministers launching the WHO Office on Quality of Care. I feel very inspired. With the political commitment we saw also from the health leaders, Minister Pluris, but also Minister of Development, Minister Georgadis, and also the Minister of Tourism, Minister Kiklias, the alternate and Deputy Minister, I am sure we are going to achieve the aim. My hope and belief is that this pocketbook will empower providers to deliver on the promise of quality primary health care for children and adolescents in the WHO European region and beyond. Thank you, and thank you again. Evcharisto Poli.
Thank you very much, dear Regional Director, for supporting with such interest the pocketbook and for highlighting the importance for primary health care and for the provision of care for children and adolescents. Having you launching this book is really very important for the team. And of course, the symbolic support here of the Greek government and the fact that we are at the facilities of the Ministry of Health, I think it's also very, very important. And this is why I would like to give the floor to the Honorable Alternate Minister, Nina Gaga, to address the audience and give us your words, please. Floor is yours.
Thank you very much. It's a great pleasure to be here for the launch of the new pocketbook for children in primary health care. Primary health care is extremely important in every country. It's the first point of contact of a person, of a family, of a whole family usually, with a doctor who knows everybody in the family by their first name, who knows what they like, what they don't like, what they prefer, and who follows them through life. And this is very important. So primary health care is the pivotal first stone in healthcare, and if primary healthcare is good, then this leads to better health, more prevention, less need for hospitalizations, less pain for families and individual people. In Greece, we have the luck to have a lot of pediatricians, especially in big cities, but still we have a lot of remote islands where a pediatrician is not present. And then we have to rely on younger doctors and general practitioners for the health of the children. And there, this book is extremely valuable. The other thing that is extremely valuable, besides the handbook, which has helped many of us in the past and still helps a lot of doctors worldwide, is the collaboration between doctors, both locally, nationally, and internationally. And this is what we can achieve through this collaboration and help from the WHO and the Office for Quality Care for the Patients, which extends to all European countries. So I think today has been a particularly good day with two initiatives that are both very important for the health of the people. Thank you very much for providing this book, and I hope it will be used to the best of our patients, of the families of children who are growing and need this. Thank you very much. Thank you, Dr. Kluge. Thank you all for this. Thank you.
Thank you very much, dear alternate minister. This is highly appreciated, and I don't resist to highlight your point on really reducing the inequalities and supporting the most vulnerable and referring to the remote places is really very, very important. Thank you for that, and of course for your great support to this launch. And I would now like to give the floor to Deputy Minister Rapti also to address the participants. Thank you very much.
Honorable WHO Regional Director for Europe, Dr. Hans Kluge, Honorable Minister of Health of Armenia, Anahita Vanessian, Honorable Minister of Health of Romania, Alexandra Rafila, Honorable Deputy Minister of Health, Alternate Minister of Health, Mrs. Mina Gaga, distinguished colleagues, ladies and gentlemen. In parallel to the original primary health care reform, we are finalizing in Greece the mental health care reform. Half of all mental health problems in adulthood start during or before adolescence. And the COVID-19 pandemic has exacerbated the mental health situation of many children and adolescents. Mental health care services that are delivered within the community and are fully integrated within the mainstream primary health care services are crucial to promote, protect, and improve the mental health and well-being of our children and adolescents. I'm therefore particularly excited to see that the WHO Pocketbook of Primary Health Care for Children and Adolescents includes information on how to promote the mental health for all children, as well as information that enables primary health care providers to identify and manage common mental health conditions at primary health care level and through referral in collaboration with mental health specialists. The National Mental Health Action Plan of Greece is being finalized now, and at its center will be a program for child and adolescent mental health, which the launch and implementation of this pocketbook complements very nicely and very timely. Thank you very much, Dr. Kluge, and thank you very much all for this exceptional primary health care for children and adolescents book.
Thank you very much, dear Deputy Minister, particularly for linking it so nicely, the mental health part and the linkage with the usefulness of this primary health care pocketbook. We will now go a little bit more in depth in terms of the features of this publication, and we will have a few other perspectives. So I would first like to give the floor to our director, Dr. Natasha Zupardi, who will give a perspective from the regional office, from the WHO regional office for Europe, in terms of this pocketbook and the work in the context of primary health care. Dear Natasha, floor is yours.
Thank you very much, dear João, dear ministers. Thank you for honoring us also with your presence. And as everyone has said, I think it is undisputed that primary health care is the cornerstone really for care, and care that starts with children and adolescents. And however, we acknowledge that the standard of care has been perhaps somewhat unavailable, and that often providers find themselves at a disadvantage, particularly when they are working out of the hospital setting and they are working on their own in a remote environment. In fact, this WHO pocketbook of primary care comes as a result of a direct request from our member states in 2017. Of course, it has taken time, and the reason is that it has gone through several rounds of internal and external consultation and peer review at the three levels of WHO, headquarters, regional office, and country office, as well as with a number of external experts and partners, and to this we are really tremendously grateful. Let me express my hope that through this pocketbook, and the reason that we have made copies available is that when one is working sometimes outside in the community, We know that in several parts of our region, even the access to the digital interface may not always be possible, particularly when people are on the move or visiting perhaps sick children in households or out in remote areas. And therefore, I hope, as I said, that through the use of this publication, which covers a very wide span of areas, we can stamp out non-evidence-based practices which can cause harm. And as an example, I would suggest the inappropriate use of antibiotics, which still remains a contentious problem in our region, the unnecessary medicalization of common conditions that can be treated safely in the community where the child remains within the family and caring environment and is not exposed to a more medicalized experience that can also have mental implications for the children. And finally, to accelerate the promotion and support for healthy growth and development to be seen as a key component of investment in the child's health and well-being, but more importantly, in the co-benefits that accrue to also our societies and economies, because the investment in health and development in the early years is one of the best investments that can be made. Thank you very much for joining us for this launch today. Back to you.
Thank you very much, Dr. Azzopardi, particularly your point on making sure that quality is at the center, because it's avoiding some of the elements that really are a challenge for us in terms of dealing with the health of children and adolescents, not always in the best way. So I think that's very important. And the point on the evidence-based and the consultations, I think is very significant. Thank you very much for that and giving the regional office perspective. I would like now to give the floor to my colleague, Dr. Martin Weber. He's been very instrumental in the preparation of this book. It's a work of 5 years that we are launching here today. And Martin and his team are the ones that are really responsible for this. We have the privilege of launching it here today, but there are many thousands and thousands of hours and days really as a background to the launch here today. So Dr. Weber, I would like to give you the floor for a short presentation.
Thank you, Dr. Breda. Honorable Ministers, Alternate and Deputy Minister, dear colleagues, it is my pleasure to give you a brief introduction into some of the main features and properties of the pocketbook of primary care. And I really have to acknowledge the work of many, many colleagues who contributed to the creation of this practical job aid, which hopefully makes a difference for the lives of children and adolescents. You were invited to this, and we try to make it more interesting to you by putting some questions to you about some features of primary health care in the European region. And I just want to allude briefly to the question which we asked about hospitalization in Europe. We asked you, what is the variation in the hospitalization rates for children under 5 years of age across the European region? And we got answers coming back, and here is a summary of what we got. We asked, is it 2 times, 10 times, or 20 times variant across the region? And as you can see, most of you thought it's actually pretty close together, but the real answer, the correct answer, is there is a 20-fold difference in hospitalization rate across the European region, which actually puts us right in the middle of one of the reasons why we produced this pocketbook. Children are put into hospital in some countries much too often. Why is this happening? What are the common problems for this? Patients often tend to bypass primary care because they have limited trust in the primary healthcare providers. And why is this trust limited? The knowledge sometimes of the diseases of children and adolescents is not always up to date, and sometimes they are just not comfortable with dealing with children because they are afraid of these little human beings. And this is leading to a lot of unnecessary referrals. Sometimes the resources required are not available, or the guidelines and the laws are not up to date. And in some countries, we know there are financial incentives for overtreatment and referral. So this is just a quick rundown of some of the reasons which we alluded over the years in our work with countries, and it brought us to produce this pocketbook to address some of these problems. So how does the pocketbook actually help to solve the problems? I just want to highlight some of the features. Obviously, it's a pocketbook. It's a bit thick, but it still fits into a pocket. It's evidence-based guidelines based on existing WHO guidelines and other evidence-based guidelines. The audience are all primary care providers. So not only doctors, but nurses, school nurses, community nurses responsible for the care of children and adolescents. And we showed you that it's supposed to be a pocketbook. How does it support the primary healthcare providers? It provides them the diagnosis and treatment and management, how to manage for most of the cases, but when to refer as well. It helps them in the coordination of the information by providing information of conditions which are usually managed by specialists, which might need to be diagnosed by specialists, but the primary healthcare provider needs to provide a continuity of care, and he needs to follow up on some of the advice. And it has very prominent parts on health promotion and disease prevention, on timing and components of well child visits, and the promotion of early childhood development as well. You can download this pocketbook now from the WHO website, so you can flick through it when you don't have the features of a practical copy, but you can look through it. So these are the main chapters of the book, providing care from birth up to adolescence, up to 19 years of age. It looks into the diagnostic approaches. Then, as I said, a lot of it is health promotion with well child visits, and health promotion in other aspects as well, from birth up to adolescence, including the messages to adolescents. We have a specific chapter on newborn health in it. The backbone of the book, the thickest part, if you look at it in the purple part on the side, is to deal with the child or adolescent presenting with a specific complaint or symptom. This is what the primary care provider needs, because people come to him or her with a symptom, and then he needs to find, or she needs to find, the guidance. We have specific chapters on specific diseases and conditions, and then one pulled out on adolescent health. Particularly prominent nowadays is we have a chapter on emergencies and trauma care, and we have lots of annexes, 10 annexes altogether, and I just highlighted 2 of them which are particularly relevant. Practical procedures described for the provider who might have forgotten how to do a particular practical procedure, and drug tables with the dosages relevant for children. I just want to run you in a few seconds each through some of the most prominent parts. For example, for well child visits, we have the parts of described on history and examination and developmental milestones, with a lot of counseling messages, how to deal with children at a particular age and to address the problems the children might having. The biggest chapter I said is chapter 6, with the child presenting with a specific complaint. It's symptom-based, and we have specific coding for diagnostic signs, for treatment recommendations, and counseling boxes. There's a wealth of illustrations in it which we have particularly commissioned to make it graphic, because many people are visually orientated, to find things again and to remember them more easily. There are boxes with important messages, red flags and counseling messages, as you can see here on the left-hand side. And we have, and that's again best visible in the copy as you have it in front of you, we have these book flaps which contain the most readily needed information, for example, the management of emergencies, that a provider needs access to most quickly if something happens. Practical procedures are describing everything in detail, how you do the practical procedure, and the drug dosages are breaking it down into weight categories, into weight bands, so people can choose the appropriate formulation and dosage for a child. We highlighted intravenous or intramuscular drugs in pink in this box, in this table. So this is where we are today, but obviously that's not the end of it, and it has been already mentioned by my director before that we are moving forward. We distribute hard copies to the contributors, to WHO country offices and end users, and it will be sold through the WHO bookshop. There will need to be country-specific adaptation, so countries can adapt it to suit their needs. We need translations, and we are already on the translation into Russian, which is still the communication languages for big parts of our region. Romanian is already underway. We want to have, because everybody has a smartphone nowadays, a mobile app, as we have it for the sister book, the hospital care for children, with integrated video materials and links to other WHO publications. Training courses will be developed to make people familiar with this, and then it goes into a whole approach of health systems intervention. We are here the Office for Quality of Care. It sets a standard for quality of care at primary level, which you can evaluate the practices against. It will be the backbone of quality improvement approaches, and it will help in the end with strengthening health systems. Thank you very much.
Thank you very much, Dr. Weber, and congratulations to you and the team. We also have a large audience which is following the launch today online, and we hope that they can also soon have access to the book first online and then to have physical copies. We're also privileged today to have with us the Honorable Ministers of Armenia and Romania. So I would like now to hand over the floor to the Honorable Minister of Armenia, which is joining us, I hope, by Zoom. I think the communication is ongoing, and therefore, Honorable Minister, the floor is yours.
Thank you very much. Honorable WHO Regional Director, Dr. Hans Kluge, Honorable Minister of Health of the Hellenic Republic, Dr. Athanasios Plevris, Honorable Minister of Health of Romania, Mr. Neo Tataro, Excellencies, dear colleagues, ladies and gentlemen. Firstly, I would like to thank the Greek Health Ministry for bringing us together today. The efforts of WHO for this important and timely initiative are highly appreciated. The issue is of utmost importance, as child and adolescent health has always been one of the major priorities in Armenia. It is remarkable to note that Armenia has good experience in fruitful collaboration with WHO in the child and adolescent health field. The implementation of WHO programs for respiratory infections and diarrhea, management of child illnesses, immunization lead to significant reduction of child mortality, achievement of high child immunization rates, and attainment of other successes. The child health agenda is still incomplete in Armenia and I think in other countries of the region. So we have to tackle many existing issues even today. Currently, our specialists work on developing child and adolescent health renewed strategy, promoting early child development, adolescent health, and the introduction of pediatric palliative care, mental health. We work on strengthening primary health care, improving the PHS staff knowledge and practices, introducing clinical protocols, reducing unnecessary hospitalizations, and introducing the modern concept of emergency care. To my understanding, many of our issues are reflected in the new pocketbook, and it is the right time for us to have such a set of new evidence-based manuals. It should be mentioned that our specialists are already in the phase of planning process of translation and adaptation of this book. Hopefully, we will have an effective collaboration with WHO in the framework of this as well. We aim not only to learn from WHO colleagues, but also we believe that our experience will be valuable in the further expansion of this initiative in the region. I would like to take this opportunity once more to thank Greek colleagues, the WHO regional office, especially WHO staff and experts involved in this project, and wish good luck to this initiative. Thank you very much.
Thank you very much, dear Honorable Minister, and thank you especially for offering to be one of the first countries to translate the pocketbook. Is very important. Your express support to this pocketbook is remarkable and very important for us. Also acknowledging the role that it can take and also acknowledging the challenges that your country is having, but with this pocketbook can actually help in overcoming some of those. I would now like to give the floor to the Honorable Minister of Health of Romania, Dr. Alexandru Rafila, also to give us a few words. Honorable Minister, the floor is yours.
Thank you, Seri. Thank you very much for inviting me. Dear and respected Regional Director for WHO Europe, Hans Kluge, Honorable Ministers, Deputy Ministers, alternate ministers, dear friends. That's important that we are here, friends and professional, to this launching, very important launching of a pocketbook regarding health services for children and adolescents. I want to express my gratitude to the Greek Ministry of Health for bringing us here for launching the WHO pocketbook of primary health care for children and adolescents. Offering high-quality healthcare services to children should be a priority for all countries. In Romania, many patients, including children, are unnecessarily treated in hospitals for conditions that could be safely treated in an outpatient ward, as we know from recent studies. Many parents still believe that hospitals are a better option for their children, and there is an urgent need to strengthen primary health care and build trust of the population in this type of health services. Doctors and nurses need to be aware of current guidelines to be able to provide health care that is evidence-based in the best interest of the child and adolescent. This pocketbook will help us a lot to address this need. We have already started the translation into Romanian, and we are also planning to make it digitally available. We are looking forward to extend collaboration with our counterparts in the European regional WHO in order to have a common approach regarding health and access to health services for children and adolescents. Romanian doctors are impatient to receive as soon as possible this pocketbook. Thank you very much, and I am very glad to join this important meeting together reviewing with the Regional Director, Dr. Kluge.
Thank you very much, Honorable Minister, and congratulations for your emphasis in primary health care, and also commend you for your words on the area of quality of care that you so much highlighted in the beginning of your presentation, and again for your collaboration with WHO. We are very much looking forward to expand this collaboration. This brings us actually to the end of the first part of this launch. We are going to have a very short break, but during this break we will have a video with some testimonies from the field, health professionals and others that we would like people to watch, that you take a look at it while we make a short break of approximately 5 minutes. Thank you very much for your participation, and see you in 5 minutes. Thank you.
I am really excited about this upcoming pocketbook for primary care, which I expect to be as helpful as the WHO hospital pocketbook has been in my experience. Also, I think it will help to safely manage children in the outpatient and avoid that kids come to tertiary care, as we all know that hospitals are not the best place to be if not needed.
We prepared the content so that any physician from Turkmenistan to Germany could use it readily on the go without any oversimplifications to the content.
Lo que más me gusta del Pocketbook es que te permite resolver las dudas de la consulta de día a día en solo un momento, y por esto creo que es una herramienta muy útil para el médico de atención primaria.
Мы так рады, что в нашей стране будет внедряться карманный справочник для первичного звена. Это очень облегчит жизнь нас, медработников, и улучшит качество услуг населения Таджикистана.
I feel that it will be a great tool for my clinical practice as a pediatrician and for my role as a primary healthcare provider.
The pediatric pocketbook has proven to be very helpful to evaluate communities due to its information and its portability.
I'm excited, thrilled to learn about the issue of the newest WHO Pediatric Handbook. It will be a valuable tool for the outpatient, office-based clinician, bringing up-to-date information on the well baby care and on breastfeeding advising.
This pediatric pocketbook is a very useful tool, especially when working with mothers to promote nutritional education and breastfeeding.
Je me réjouis de découvrir cet ouvrage qui va être vachement utile pour la collaboration avec les pédiatres et notamment dans la réflexion sur les diagnostics différentiels en pédopsychiatrie.
Besides the fact that it represents a highly useful tool for primary care professionals, I'm pleased to note that the pocketbook includes several sections on adolescent health and medicine, such as developmental and mental health conditions, sexual and reproductive health issues, or substance use disorder. I wish the pocketbook a great success.
Strengthening primary healthcare is an absolute priority for us here in Kyrgyzstan. The pocketbook allows us to support primary healthcare practitioners with very concrete and practical tools on how to improve quality of care in their daily practice.
By this, we have got an excellent and comprehensive tool which will lead the countries of our region to work on improving child and adolescent health.
I'm really excited about this, and I truly believe this is a game changer, and it will undoubtedly change the lives of many people. I'm really excited about getting a copy of this book.
Good afternoon. I hope everyone has come back and enjoyed their break. My name is Pavlos Theodorakis, and I'm a senior health policy advisor at the regional office of WHO. In this session, we would like to focus on children and adolescent mental health in the pocketbook and how it can support the implementation of the program of children and adolescent health that we just launched this morning with emphasis on mental health. So I will have the pleasure to invite my dearest colleague, Dr. Lydia Lasry, who is the regional advisor for mental health in the European region, to talk about the pocketbook with special attention to the children and adolescents' mental health. Dear Lydia, the floor is yours.
Thank you. Thank you, Dr. Theodorakis, and dear ministers, Madam Rafti, Madam Gaga. It's a pleasure to have been with you today for launching the WHO Quality of Care program, the office, but also the program for mental health of children and adolescents. And it cannot be more timely that this book is presented today when we are starting a very energetic action in Europe to support mental health and well-being for children and adolescents. For this, I am very grateful and honored to be on the same side with my colleague Martin Weber and also another colleague, Susan Karai, who have been very instrumental in developing the pocketbook, and of course the team behind them. Now, how is this pocketbook relevant to mental health? Before we go to a little bit of discussion, I would like to remind the audience that this question was part of the consultations done by WHO Europe with stakeholders. And one of those questions was, in low and middle income countries of the WHO European region, where does self-harm rank as a cause of death among adolescents 10 to 19-year-olds? And many people thought that most of the responses came to say that the rank was the fourth. So self-harm rank would rank as fourth cause of death among adolescents, but actually is the first. So what we see is that there is a big lack of information when it comes to the relevance of mental health conditions, practically self-harm and suicide, as cause of death among adolescents. And what we know now is that suicide is the first leading cause of death among adolescents in low and middle income countries, and second leading cause of death in high income countries in WHO Europe. So we can see that suicide carries a great burden of mental health disease in our region, and there is a lot of misinformation about lack of information, lack of understanding, lack of literacy. There are a number of reasons about this, chiefly among them stigma around mental ill health, and the fact that due to stigma, due to lack of information, people, communities are not talking about, and this is how we lose so many lives in our region to suicide. The pocketbook comes very handy because the current situation in adolescent mental health in Europe is that anxiety and depression are among the top 5 causes of overall disease burden for adolescents. And half of all mental health problems in adulthood have been started during or before adolescence.
And most member states report that adolescent mental health is a problem in the countries. This came also very strongly during Athens summit on the mental health impacts of COVID-19. And as we heard from the surveys and the evidence assessment that WHO had carried out, but also as we heard from member states here in Athens in July last year, children and adolescents were among the most affected groups when it comes to mental health impacts of COVID-19. In addition to that, we also know that mental health services in the community, and especially in primary health care, are underdeveloped in many settings. So we have a great deal of underfunded, underprioritized, and under-resourced mental health services all over Europe. We have an uneven distribution of that problem across Europe, but no country is sufficiently, adequately funding their mental health services. Now, how is the pocketbook addressing these challenges? The pocketbook, as it targets primary healthcare workers, it aims at enabling them to identify and manage mental health conditions in health facilities or through referral. And it also enables primary healthcare providers to coordinate work with specialists specialized mental health services. This is why this pocketbook is breakthrough, because in many contexts across our region, we have primary healthcare workers that are totally disabled in providing this kind of coordination and management. Now, how is mental health reflected in the pocketbook? We have in Chapter 3, my colleague Martin Weber mentioned the well child visits, and the aim is to promote and protect mental health through well child visits for the age groups that you see in the screen. Then on Chapter 4, we have the pocketbook talks about health promotion and disease prevention, which aims at supporting mental health and well-being. Then we go to Chapter 6, that focuses on child or adolescents presenting with a specific complaint or symptom, which is usually a hiccup among primary healthcare providers, because there is not sufficient skills and information about how to and what to do with a child or adolescent that is presenting with the symptoms listed in this screen. And the chapter aims at focusing on assessment. So how do you assess an adolescent or a child that is presenting with one of those or many of those symptoms? It identifies what are the red flags. So how are you able to, through assessment, identify where are the most painful points, the points for immediate action. It runs through differential diagnosis, and then it goes to management. So how do you manage those symptoms, and what do you do as a primary care provider into dealing with cases like that? Then we have Chapter 7 that focuses on disease and conditions that specifically when the child or adolescent who might have or has developmental difficulties, autism spectrum disorders, and the other disorders there. So what happens when the primary care provider receives in their visitation rooms a child or adolescent that has already been diagnosed with one of those conditions? And this is again a hiccup in our primary health care that are very often not unable to deal or to face or to cope with cases like that. The Chapter 8 focuses on adolescent health and picks up the adolescent with emotional and behavioral problems, as well as an adolescent that is living with chronic conditions. And as we know very well, in adolescents, like in adults, living with chronic conditions may complicate also mental health and well-being of the individual. Now, what is the way forward? How can we use this book as to move forward? As many in the audience know, at the European level, we have had the WHO European Framework for Action on Mental Health, and the pocket book will come very handy as an instrument that will help designing and implementing the working package of the mental health and well-being of children and adolescents. And for that, we hope that the quality of care care for children and adolescents mental health that was just launched here today in Athens, we hope that this program here will be the niche for moving forward, for implementing what the pocketbook says, and for allowing us to enable and to empower our primary health care workers into taking forward mental health for children and adolescents. The implementation vehicle for this is the Pan-European Mental Health Coalition, and I mentioned the package. I mentioned the quality of care program now that was launched today in Athens. And in the pipeline from tomorrow, I'm happy to inform our Ministry of Health colleagues that from tomorrow we are starting immediately with the consultations through expert groups for putting the design of how we use instruments like this pocketbook into designing the working package. Then we will have a Pan-European Mental Health Coalition meeting where we'll discuss what will have been drafted as a working package, and we hope to be able to return to Athens for discussing how the working package has gone forward and how shall we disseminate it among our stakeholders. And with this, thanking again our WHO colleagues that have put this document forward, I'm again indebted to the government of Greece for boosting mental health support in the WHO European region. Thank you.
Thank you so much, dear Lydia. Very comprehensive presentation, how you can use what can this book provide for primary care in relation to mental health. And now we'll call all of you to have a virtual trip some 1,000 kilometers away to the birthplace of primary health care in Almaty in Kazakhstan, where our good colleague, technical officer Aygu Muratova will further expand on the relation between primary care and mental health. Aygu, the floor is yours.
Thank you very much, and Pavlos, thank you very much, Martin and Lydia, for the excellent presentation. I'm happy to connect from Almaty, from the heart of the primary health care. We just heard about the burden of mental health problems in children and adolescents and the challenges that they face to access quality mental health services they can afford. The WHO European Office on Primary Health Care works on strengthening primary health care to deliver mental health services, and children and adolescents are on spot. Recently, we held a talk show on scaling up mental health services in primary health care, strategies to accelerate, with a deep dive session focusing on adolescents. The participants from all over the region have seen a lack of service or of revised and integrated evidence-based and essential guidelines, a lack of training on mental health, lack of competencies and skills to diagnose and manage mental health problems among the major barriers towards this target. For example, good understanding the developmental needs and building accordingly the communication with the adolescent's client is one of the key competence of primary health care providers in working with adolescents. The pocketbook of primary health care for children and adolescents will help us tremendously in this work. These up-to-date guidelines and decision aid will help primary health care providers in promoting mental health and well-being for all children and adolescents, and in identifying those who would benefit from more support in dealing with mental health issues. The Primary Health Care Office in Almaty will join the effort to implement the pocketbook to ensure that all children and adolescents receive the care they need according to the children's rights and evidence-based standards across the WHO European region. Thank you very much for your attention.
Thank you so much, dear Aygu. It was wonderful to see how all these efforts come together to make a difference for our children and adolescents across the Europe and beyond. With this, I would like to end this first part of the session and hand over to my good colleague and head of the WHO Athens Quality of Care Office, Dr. João Breda. João, over to you.
Thank you very much, Dr. Theodorakis. It's always a pleasure to co-chair sessions with you. And now we are going to move into a second part, which is really very important because it's about partnerships, organizations, and people we work with. Martin's team and the others have worked in preparing this pocketbook, and also to feel their reaction and eventually, I'm sure, their support to this very important pocketbook on primary health care for children and adolescents. So I have a series of remarks from partners which I'm sure you will enjoy very much. And the first one is from Dr. Anna Stavdal. She is the president of the World Organization of Family Doctors, better known as Wonka World. And this is a pre-recorded video that I would like to ask my colleagues in the régie to start putting on air, please.
This pocketbook of primary care for children and adolescents provides a useful framework for building trust as we meet and care for young people. Thanks to community-based services supporting continuity of care, we family doctors often get to know generations of the same family, meeting patients at all stages of life, some even before they are born. These relationships evolve over time. The insights we gain often prove extremely powerful, particularly for our younger patients. We were able to tailor caregiving to that specific person's age, gender, and living conditions, extending best evidence medicine to include the links between health issues and social factors. Our understanding of how life and life events are inscribed in the human body can be put into practice. Caregiving is more than conventional medical treatment and disease prevention. Our generalist medical approach involves contributing to health literacy and empowering patient self-care, helping us to activate our patients' individual and network resources. And for our younger patients, it also requires us to recognize past and ongoing adverse childhood experiences. We even intervene when necessary. We may then help avoid or at least limit the future negative health consequences so often associated with early life trauma. Tailoring care carries with it yet another daunting responsibility. We must stop or at least slow the trend toward medicalization of difficult but normal phases of childhood and adolescent mental and physical development. Thank you very much.
Thank you very much for that very inspiring video, Dr. Anna Stavdal. It's a very important organization with whom WHO has been working for many, many years. Now, Dr. Roberta Petrucci, she works for MSF, Médecins Sans Frontières, as you know, and she is the leader of the International Pediatric Working Group. We will have Dr. Petrucci live, hence by Zoom, I suppose. I would like to hand over the floor to Dr. Roberta Petrucci, please.
Good afternoon, everybody. It's a great honor and pleasure to be here today with you for the launch of the pocketbook for primary healthcare for children and adolescents. And we are very grateful for having had the opportunity to participate in the revision. We see this guidance as a great opportunity to make sure that every neonate, child, and adolescent receive the best possible care, no matter where they seek medical attention, and especially not only in specialized pediatric units. And to do so, we specifically need to address and invest in primary healthcare settings, where our frontline colleagues usually don't have access to proper pediatric training, and often they're not at ease to treat this kind of population. We know by experience that every time we invest in primary healthcare, we not only decrease morbidity and mortality, but we also reduce hospitalization, we optimize the use of drugs and antibiotics, we promote health, prevention, immunization, we empower community, we can address long-term chronic conditions, and even more important, because it's often neglected, we can invest in child well-being, including growth, nutrition, neurodevelopment, and as previously presented by previous speakers, we can address mental health issues. And by doing so, we can give every child and every adolescent a better chance to thrive and have a fulfilling, healthy life at their full potential. And by doing so, we also benefit all the community. So we welcome the Pocket Book as an important milestone to achieve health for all. We hope this initiative will not only be limited to European region. So congratulations for this launch, and all my best wishes to all the countries and partners for the implementation phase. Thank you very much.
Thank you very much, Dr. Petrucci, for your kind words and for the value that you really pulls on this pocketbook. We are delighted that you are considering using it extensively. Thank you so much. It is now time to move to the contribution from the European Pediatric Association. EPA, UNEPA, is again a live contribution via Zoom, and I am delighted to hand over the floor to Dr. Massim Petoello Mantovani. Floor is yours. Thank you.
Thank you very much. Respectable national and international representatives, dear colleagues, as President of the European Union of the National Pediatric Societies, EPA-UNEPSA, I would like to say that EPA-UNEPSA is indeed extremely proud to have contributed as a partner to the development of the WHO Pocketbook on primary health care for children and adolescents. Primary care is one of the three founding unitary and unbreakable components of pediatrics: primary, secondary, tertiary care pediatrics. And it is indeed on the front line of pediatric health care. And this book will certainly help pediatricians to deal with sometimes apparently simple but often complicated health matters. A special thanks goes to the team leader of this project, Dr. Marty Weber, who is a long-time friend and colleagues, for his hard work on developing it. EPA-UNEPSA really wishes the best success to this book, which we really are sure it will have. And I thank you very much on behalf of EPA-UNEPSA for this privilege to have been partners in this very important project. Thank you.
Thank you very much, Dr. Massim Petoello Mantovani. Very important support, and we are grateful for that. I would like now to give the floor give us the opportunity to watch a pre-recorded video from Dr. Shimon Barak. He is the president of the European Confederation of Primary Care Pediatricians, hence very important. And I would like to ask our colleagues in the regie to put the video on from Dr. Shimon Barak.
Hello. More than 44 years ago, the World Health Organization took a giant leap with the Alma Ata Declaration, a major milestone in the field of public health that identified primary health care as the key to the attainment of the goal of health for all. Primary care health service is not a faceless megastructure. Its key component is human, dedicated health professionals performing their task. The care of children and adolescents in the European region is provided variously with three main systems of primary pediatric care coexisting: an exclusively pediatric-based, a combined system with care provided by both pediatricians and general practitioners, and an almost exclusively GP family doctor system with most primary pediatric care provided by general practitioners. We are a confederation of primary care pediatricians, but we have set the goal for optimizing and improving primary care of children and adolescents in Europe, regardless of the identity of the primary health caretaker in the different countries. Therefore, We elaborated and published a curriculum of primary pediatric care that is now a worldwide example used for postgraduate training of pediatric providers in Europe, Asia, and America. While doing so, we understood that although all 54 countries of the European region want the best care possible for their children and adolescents, not all of them get the quality of care they deserve, as many of the professionals undertaking the task have not had until now the professional basis to perform adequately. Now the WHO is undertaking the editing of the WHO Pocketbook of Healthcare for Children and Adolescents to fill the void in knowledge and expertise in the field of ambulatory healthcare of children. ECPCP has had the honor of contributing as co-author and editorial advisor during the last 3 years. ECPCP has also contributed together with EPA, UNEPS and WHO in the elaboration of the publication of the evidence-based for 10 preventive interventions. The content of training includes promotion of health, prevention of disease, infant care, vaccinations, acute care, emergency care, and care for the chronically ill children. All these topics are covered in detail and up to date in the WHO Pocketbook of Healthcare for Children and Adolescents. Thank you for considering us for the task. I can assure our participation in the promotion and good usage of the Pocketbook among our members and related organizations and societies. I want to congratulate the editorial team and especially Suzanne Karai, Martin Weber, and the staff of the Child and Adolescent Health Department of the WHO Copenhagen. And with your permission, I would like to end with a thought and a prayer. Children should get the best qualified care by well-trained providers. There are many disparities and deficiencies in the healthcare. While this is true in times of peace, it is 1,000-fold more severe when war and conflict make children suffer from direct physical harm and lifelong lasting trauma for their souls. We pray for the hostilities in Europe to stop and ask the parties involved to do the utmost to ensure the safety of children in Ukraine, and the pediatricians of Europe to express a clear and loud position against the war while confirming solidarity and professional support for the medical staff in the Ukraine. Thank you very much.
Thank you very much, Dr. Shimon Barak. Your passionate statement of support is very much welcome. We are grateful for that. Coming from the European Confederation of Primary Care Pediatricians, this is very important. I was delighted to see that this is a real voice from the field. You are sitting there in your office where you probably see many, many children every day. And we are really very grateful. I think this was a truly inspiring example. So now the last contribution, but not the least, of course, is coming from the European Academy of Pediatrics, EAP. From its president, we have a pre-recorded video as well. Dr. Adamus Agipanais, I would like to ask my colleagues in the regie to put the video on. Thank you.
Primary care pediatrics deals with newborns, infants, children and adolescents in outpatient or ambulatory settings like public health clinics, health centers, solo group practices under the national health system or privately. It includes all aspects of prevention, diagnosis, management and rehabilitation, the coordination with these specialties to provide continuity of care to children with complex and integrated care needs, extending to the psychosocial sphere as well as health promotion and advocacy. European Academy of Pediatrics aims to promote health of children as well as to alleviate suffering from diseases in infancy, childhood and adolescence up to the completion of growth and development both within and outside of Europe. WHO Pocketbook of Primary Health Care for Children and Adolescents is a great achievement, and I'm proud that European Academy of Pediatrics was involved in this initiative. I'm confident that these booklets will be an excellent tool for all physicians caring for children in the community.
Thank you very much. This was an incredible roundtable, an amazing show of support to the pocketbook. We are really very grateful, and we would like to warmly thank all the partners who worked so hard, really hard in the last 3 to 5 years to develop and publish and launch here today. Today is the easiest part. We're all celebrating. But we are looking forward really to work together with all the member states and all the partners to really strengthen this partnership. And of course, a great sign would be the translation of this book in as many languages as possible at the national level. So very grateful for that. It's been really an honor to stand here to be launching this pocketbook again here in Athens today after a morning where we celebrated the opening of the facilities of the new Quality of Care Office, but also launching the new mental health program for children and adolescents from a quality perspective, which is very important. WHO is about partnerships and bringing together, convening partners to support our constituency, our member states, and therefore we are delighted that we had three health ministries here. We had the support of 3 countries, very, very strong support. But not only that, we also had several partners, organizations from across the region, and that is very significant for us. We also have the support of UN partners and, of course, all the colleagues and frontline health workers from across the region. Many of them were online. There was an outstanding participation online via streaming, as I was informed. So this is a small, cozy meeting here, but out there's a lot of people that are really enthusiastic, and we keep receiving many messages of support to this pocketbook. We're also going to announce the winner of the first hard copy of the pocketbook of primary health care for children and adolescents in a symbolic way. I would like to take a moment, although on behalf of the RD, to thank everyone involved in the preparation and the development of this pocketbook, particularly the members of the editorial group. There's a large number of contributors, very strong, very solid, scientifically solid editorial group. They dedicated their time, their knowledge, and their wisdom to the development of this incredible tool over several years. Our partners and member states have been providing technical and financial support, as well as the WHO staff across the 3 levels of the organization. This is really a product led by Europe, but a product of the collaboration between the 3 levels really working together. I would now like to say that the winner of this pocketbook is a pediatrician from Slovenia, and her name is Dr. Kata Gornik. Rest assured, we'll find a way to send you this book. And congratulations. So, it's been really an honor and a privilege to launch the book here today with you. This may be the end of a long process, but more importantly, it's just the beginning of an even longer one. We are convinced, our RD is convinced, that if we all join together and with the political commitment and technical expertise we have seen is actually possible, we can meaningfully support the work of many primary healthcare workers so that they can deliver on the promise of quality primary health care for children and adolescents in the WHO European region and beyond. Thank you very much. The meeting adjourns. Thank you.